Hello and welcome to your 2021 benefits. On the screen are the items that we will go over. So your medical plans are changing from Aetna to Blue Cross Blue Shield, no changes to your dental or vision, and then some changes to your voluntary life and Aflac products. Your open enrollment starts on November 16th until November 21st. You have until the 21st to complete your enrollment forms and return them to your HR representative at CBR. The benefits that you will elect start on January 1st, 2021. All employees that have met eligibility criteria are eligible for the benefits. Aside from yourself, your legal spouse, domestic partner, and children up to the age of 26. As I stated previously, these benefits will begin on January 21st, and you are locked in for 12 months. You cannot make any changes unless you experience a qualified event. And on the screen are some examples of those: marriage, divorce, birth of a child, and loss of coverage. You have 31 days from the date of the event to notify your HR team that you would like to review your benefits. If you exceed the 31 days, you will have to wait until the next open enrollment period. These are the medical plans that you have to choose from. Your first plan is called the PPO 5000 HDHP. This is a high deductible health plan, which means all services, all doctor visits, urgent care, emergency room, and pharmacy are going to be subject to your deductible first. The only thing that is not subject to your deductible is going to your preventative care, your age-appropriate exams and screenings, FDA-approved contraceptives, and preventative drugs. All other services are going to be subject to your deductible first. The next plan available is the PPO 6350. 6350 is an individual deductible, 12,700 is a family deductible. Now, if you've met this deductible in the calendar year, you're going to be covered at 100% for all services in that calendar year and in network. You do have your preventative care covered at 100%, so your age-appropriate screenings and exams. You also have copays for your office visits or walk-in clinics at $25. Your specialist copay is $50. Your urgent care is $75, and your emergency room is $250. You do have access to pharmacy before your deductible. Your generic drugs up to $10 copay for a 30-day supply. Your brand name preferred medications are a $35 copay. Your non-preferred medication are going to be either $60 or $120. Please review your summary benefit of coverage for additional 4 tiers for specialty medications. The next plan that you have available is this PPO 6500. Now this plan is using the Alliance Network. The 2 previous plans are national networks that include the Phoenix Children's Hospital and Mayo Clinic in the network. This plan, Alliance here on the screen, does not. It includes Honor Health, Banner, Cardinals Children, and University Medical Center. So this plan is a $6,500 individual deductible, $13,000 family deductible. Now, if you've met that deductible, you will be covered at 100% for that calendar year in network. You have your preventive care services covered at 100%. That's going to be your well man, well child, and well woman check, age appropriate screening and lab work. Your office copays for your regular doctor visits or walk-in clinics is going to be $30. Your specialist is $65. Your urgent care is $75 per visit. Emergency room is $250 per visit. Now keep in mind, if you use the emergency room and you're going to be spending the night, you will start to pay towards your deductible. You also have copays for your pharmacy, again for 30-day retail supply for your generic drugs up to $10, your brand name preferred up to $35, your brand name non-preferred either $60 or $120, and then you have 4 additional tiers on your SBC. Health savings account. So you do have a high deductible health plan that is being offered to you today. It is the PPO 5000. And this allows you to open an HSA account and put your pre-tax dollars away. So a couple of qualifiers. Number 1, you have to enroll in a high deductible health plan. Number 2, you cannot be covered under any other plan that has copays. If you're covered under a spouse's plan, a domestic partner, access, or TRICARE, and you have copays before your deductible, you are excluded from opening an HSA account. Also, you cannot be covered under any part of Medicare or enrolled in Medicare. If you are Medicare age but not enrolled in Medicare, you may participate in the HSA. Also, you cannot be claimed as a dependent on somebody else's tax returns. Other than that, if you can enroll in the HSA, put your pre-tax dollars in there. Keep in mind this HSA account or health savings account is your account. You own it 100%. The money that's in that account is your money. It goes with you, stays with you, rolls over year over year. Now, for the 2021 plan year, your maximum pre-tax dollars that can go into the account for an individual is $3,600 and for a family, $7,200. If you are 55 plus, you may add an additional $1,000, making it $4,600 and $8,200. Again, as a reminder, the money goes into the account and is ready to use as it's deducted from your paycheck and put into this account. This is your money and it rolls over year. If you're enrolled in a high deductible health plan today and plan to enroll in a high deductible health plan for 2021, you do not need to open a new account. Next is the flexible spending account or FSA. Similar to the HSA, these are pre-tax dollars that you can utilize for your medical services, dental, or vision for yourself and your dependents. On this account, the FSA, here on the screen, it is a standalone option, which means you do not need to enroll in any of the medical products in order to qualify. So the maximum for the calendar year is $2,500. Again, it is front-loaded on this card, so when you receive the card in the beginning of the year, you can start utilizing those dollars. And then it's deducted from your paycheck for the rest of the calendar year. If you leave the company, the card is turned off. You do not take it with you. Also, there is a maximum rollover of $500 into the next plan year. Anything over $500 on December 31st, you will lose. You also have dependent care FSA. So again, these are pre-tax dollars that you may utilize to pay for services or pay yourself back for daycare or elderly care. Your new telemedicine beginning January 1 will be Blue Care Anywhere. So yourself and anyone enrolled in the Blue Cross Blue Shield medical plans have access to this telemedicine program. The medical can diagnose anything from pink eye, earaches, UTI, sore throat, rashes, and the doctors can send a prescription to a pharmacy that's closest to you. You may utilize these services when you travel or when you're home anywhere within the United States. They also have counseling and psychiatry services. All three services will be at no copay to you beginning of the year. Your dental options, no change to these plans. So your first dental plan is a PPO-based plan. So you have an allowance to use towards your services, in this case $1,500 per person enrolled in the plan to use towards their dental services. Then you get an additional $1,000 per child to use towards child orthodontia, and that's a one-time lifetime benefit. Preventative services, your 2 cleanings twice a year are covered at 100%. Your basic services, such as cavity or emergency services, are covered at 80% and you pay 20%. Your major services, such as a root canal or a crown, it's a 50-50 cost share. Now, if you utilize the basic services or the major services, you will be subject to a one-time deductible of $50 as an individual or $150 as a family. The next plan is the DHMO plan. So on this plan, there is no deductible, there is no annual maximum. You do have to pick a primary dentist for yourself and each member of your family, and you may each have a different dentist. You still have your preventative care services, which are your cleanings twice a year, and all other services are on a fee schedule. So here on the screen, you see an example of the fee schedule. So the first section is diagnostic, no cost to you for those annual exams. And as you thumb through the multi-page document, you will find all of the dental codes, and you will look for the dental code of whatever treatment plan that you want to have done, and that is your out-of-pocket expense. So that's what you will pay for the service, no more than that. That's why it's important to designate a dentist, because they've agreed to charge no more than what's listed on the fee schedule. Now, if you do not pick a dentist, Delta Care USA will assign you a dentist based on your home zip code. You may change that dentist at any time during the calendar year. The Delta Dental website is also available and the mobile app, so that allows you to look up dentists, see how much of a benefit you have used, or download your ID card. Your vision plan, no changes to the vision plan. It remains exactly the same. So your eye exam is available every 12 months at a $10 copay. Your frames, you have a $120 allowance to use towards that service and then a 20% discount above that. Your lenses, your plastic single, bifocal, or trifocal lenses are at a $10 copay. Your contact lenses in lieu of your lenses for your frames is an $80 allowance and then a 15% discount above that. Medically necessary contact lenses will be covered in full. Your life in AD&D, the voluntary products are moving to MetLife. You will have to complete a new form if you want to continue with your current voluntary life coverage. All you have to do with that MetLife form is right across the top, your information, your name, your beneficiary information, section 5, and in the box where it says voluntary or supplemental life, check the box and write keep the same. If you are enrolling for the first time, you will have to complete that as well. Check the box and indicate how much life coverage you need. So the life benefit, all employees working 20 plus hours are eligible. It is 5 times annual earnings up to $500,000. The guarantee issue for those of you that are newly eligible or newly enrolling is 5 times base annual up to $200,000. And then guarantee issue for your spouse is going to be $25,000. Guarantee issue for children is $10,000. And on this plan, there is no benefit reduction. So the amount that you purchase in life insurance is what you have available till the termination of the policy. Short-term disability and long-term disability, it is also changing to MetLife. If you are enrolled today, you do need to complete a new form and just check the box that says short-term or long-term and just write keep the same. There are no changes in the premiums unless you change brackets due to your age. The short-term disability starts to pay at the 14th day of illness, accident, or hospitalization. It pays up to 60% of your pre-disability earnings up to $1,000 a week. The benefit duration on this plan is 11 weeks. And it does have a pre-existing limitation that I will go over shortly. The long-term disability starts to pay at the 90th day or at the termination of the short-term disability policy. Again, it covers 60% of your pre-disability earnings up to $7,500 a month. This policy lasts until age 65 or normal Social Security retirement age. So if you're enrolled today on the short or long-term disability, you have already satisfied the pre-existing limitation. If you're enrolling for the first time, it does apply to you. So if you saw a provider, took medication, or diagnosed with a condition 3 months before the effective date on which you went out on leave in 2021, it would not be compensable. Any other condition would be compensable. Your Employee Assistance Program, this is available to all employees whether they enroll in benefits or not. It's available 24/7, 365. It is a website that you visit or you can give them a call. There's a flyer that's also included in your email. So it includes 3 face-to-face visits or telephonic Skype visits per incident. It is 100% confidential. The website also has additional information and self-help videos, and family discounts are available. The AFLAC projects are changing to group policies. If you have not received a call or text from an AFLAC representative, you will have a contact. So the accident policy is changing. So it's now going to cover a lot more and it's going to be a lot less expensive. Critical illness is now tied with the cancer policy. So it's one policy with really good savings and really good coverage. There is information in your inbox, so you do have to go to the timetrade.com link to set up an appointment, email Jose or call Jose, and he'll be happy to go over what you currently have and what the changes are and what your savings are going to look like. Pet care is still available through United Pet Care, so no changes to this plan. It did go up $1 and change, $1.20, I believe. And again, no breed is excluded. All pets are covered except for fish. You do have to enroll online. You have to go to the unitedpetcare.com/CBR to enroll. And you also may enter your zip code in there and see if the veterinarian that you utilize today is already part of the United Pet Care program, so you can start saving on those visits. Legal Shield and ID Shield is available as well. No changes to current. You have a flyer and instructions how to enroll and what the cost is. You may enroll in the Legal Shield and the ID Shield together or separately for yourself or your family. So next steps, we'd like to get everybody to enroll or waive by the 21st of November. So you have to complete your form, return it back to your HR representative, and that's all we need from you. If you're not enrolling in anything else or not purchasing any other products or coverages, the only thing we need from you is your enrollment form with your information indicating what you're enrolling in or if you are waiving. There's nothing else that we need from you. If you are enrolling in the life insurance, short-term disability, long-term disability, you will have to complete the MetLife form. Remember to update your beneficiary as needed as well. If you are interested in the Aflac products, please contact Jose and make an appointment as soon as possible so you can go over those the pricing and how much potential savings you have. Also, if you're enrolling in the flexible spending account, again, this is 100% voluntary. You do have to enroll year over year. It does not automatically roll over. If you have any questions, please do not hesitate to contact your CBR team.